A new survey shows that the reported health needs of people in Smith County. It was conducted by the UT Tyler School of Medicine and the East Texas Human Network. The data shows needs in areas including employment, transportation, and medical care. KLTV's Madison Myers has more on what these results mean.
Health professionals, along with several members of the East Texas Human Needs Network, gathered to share survey results of the health needs in Smith County. The survey was given to people that live in low-income areas, majority of them making less than $30,000 per year. Associate Professor of the School of Health Professions, Michael Morris, tells us how these survey results can help enhance future health care services.
This data is going to allow us to work with creating strategic visions for what services we need to enhance, what we need to grow, and that allows us to better leverage community resources and external resources.
According to the survey responses, 37% of people are not able to pay their bills every month, 32% aren't able to get prescription medications, and 29% don't have adequate dental care. The results also showed that within the past 12 months, over half of the respondents worried that their food would run out before they got enough money to buy more. Board President of the East Texas Human Needs Network, Jesse McKenzie, says that this data is essential to those who may be struggling with everyday needs.
Our hope is that organizations here today can use this information to apply for grants in their own organizations, to bring resources to the community for areas that may be underserved or unserved altogether.
The East Texas Human Needs Network also says that these results can be used for data-informed project planning and to create or expand on new services. Madison Myers, KLTV 7 News.
The East Texas Human Needs Network plans to share these survey results with the Smith County officials and other community leaders.